Member baru habis kan, masuk repro kan.
Dah jam dah.
Macam wah, benda aku belajar kan.
Kalau dia seat kosong, sila free.
Jeffrey. Kau lah.
Okay, boleh masuk. Cepat. These are the, okay, about schematic chord, I takut overlap dengan elementary module. So these are the contents of the schematic chord. Yeah, banyak 3 arteries, 3 veins, 3 facial coverings, 3 nerves, 3 arteries. Okay. This is important during the surgery posting later in clinical case. The surgeon might ask what are the contents of the spermatic cords. Okay, so baca, these are all the contents, either the inside deep inguinal ring, okay, or after that in the canal, or after that in the superficial inguinal ring. Okay, these are all the components, 3 arteries given, 3 facial covering, 3 nerve, and 3 others. Okay. Now we go to the ejaculatory duct. Okay, ejaculatory duct. Here, okay. A 2 cm tube formed by the joining of the vas deferens. This is the vas deferens and the duct of the seminal vesicle. Okay. So tadi vas deferens dia akan jadi ejaculatory duct. Tapi this ejaculatory duct also is formed by the joining of other duct, which is the seminal vesicle duct. So what this function is empties into the posterior wall of the prostatic urethra. Okay, this is the prostatic urethra, and between the median and lateral lobe of the prostate, this is the median lobe. This is the posterior lobe of the median and lateral lobe of the prostate. Okay, towards its opening on the seminal folliculus. It's opening into seminal folliculus. Okay, so that's opening of the ejaculatory duct. Okay, seminal vesicle yang besar ni, okay, is nama lain sometimes book called vesicular glands or seminal glands. Okay, a pair of 5 cm long or tubular glands lie immediately above prostate gland, and lateral to the vas deferens. Okay, the seminal vesicle is always lateral to vas deferens, not medial. Okay, and attached to the vas deferens near the base of the urinary bladder is very active and produce fluid approximately 50% of the volume of the ejaculate and becomes smaller with age. So 50% of the ejaculation fluids is from the seminal vesicle. Then bulbourethral gland. Okay, so nama lainnya corpus gland. A pair of pea-sized exocrine gland located at the deep perineal pouch, lie posterolateral to the membranous urethra. Okay, sebab membranous urethra also is part of the contents of the deep perineal pouch. So it's lie posterolateral to it. Its long duct, the duct 3 cm penetrates the perineal membrane. Okay, and open into the proximal part of the spongy urethra. So duct of the bulbourethral gland is located at the superficial perineal pouch. The gland itself is located at the deep perineal pouch. Okay? So the secretion about 5 to 10% of the total ejaculate volume. So it secretes mucus in the semen for the lubrication. Okay. Prostate gland. This is the prostate gland, walnut-sized gland only in male at the lesser pelvis. This is the measurement, okay, and is most majority comprised of glandular structure. Only 1/3 of the fibromuscular and mainly at the fibromuscular and mainly is just post muscle. Enclosed by the fourth capsule or prostate fascia, there's no true fibrous capsule at the base or apex of the prostate. So, base dengan apex nanti tak ada true fibrous capsule. Okay, tapi dia ada part ada true fibrous capsule. Okay. Lepas tu it's enclosed also by the false capsule. Nama lainnya prostate fascia. So what is the function of the prostate gland? To produce fluid with protect and sperm. Okay, and is contribute about 40%. Okay? So complete lah 100% of the fluid volume of the ejaculate. So this is the capsule again of the prostate. You can see the false capsule ataupun prostatic fascia and true capsule ke dalam ni. And okay, so between them ada prostatic venous plexus. Okay. So the true capsule is in a layer, thin, strong layer of connective tissue. Okay. So you can tahu the location of the prostatic venous plexus is important sebab dia boleh migrate ke vertebra, ke brain using because of venous plexus. Okay. So the location is between the true capsule and false capsule of the prostate gland. Okay. This is the location of the prostatic venous plexus. Okay. So, base posterior, okay, base is superior, okay, apex is inferior, okay, and this is anterior, and this is the posterior surface, okay. Base or superior, contiguous with the neck of the bladder, 4 cm in diameter. The apex surrounding the junction of the prostatic and membranous urethra. Prostatic and membranous urethra, okay, surrounding here, and then okay, urogenital diaphragm and rectouterine muscle. Anterior surface lies in the pubic arch, present of the puboprostatic ligament and where the urethra emerge. And posterior surface, two ejaculatory ducts penetrates. Okay. Present of the medial sulcus, fascia oblongata, okay, and also there's also infralateral surface present of the puboperinealis muscle. Okay, so this is puboperinealis muscle. This is rectouterine muscle. Okay, this is fascia oblongata. Okay, and then this is the puboprostatic ligaments. Okay, so lobes of the prostate ada 5 okay, anterior lobe. This is sagittal section. Okay, ini depan, this is anterior, and this is posterior. Sagittal section. So this anterior lobe or nama lain isthmus, anterior to the prostatic urethra. Posterior lobe common for carcinoma. Prostate CA common in the posterior lobe. Okay, is posterior to the prostatic urethra and inferior to the ejaculatory duct. Okay, median lobe ataupun sini common for benign prostatic hyperplasia. Okay, not cancer. Is posterior to the prostatic urethra and superior to the ejaculatory duct. Okay, and then 2 lateral lobes on either sides of the prostatic urethra. That is lobe, and some of the pathologists selalu pakai classification zone. Okay, so I can ask both, either lobes or also zone also. Okay, so zone ada 4. Anterior zone, which is fibromuscular zone, ini orange ni. Okay, ini pandangan atas, pandangan tepi. Central zone. Okay, this is central zone, about 25% tissue surrounds the ejaculatory duct. Left and right here. Mana kat sini? Central zone. Okay, warna biru. Okay, this is ejaculatory duct. And then the transition zone, 5% only. Okay, surrounds urethra. Common site for the benign prostatic hyperplasia. And last but not least, 70% peripheral zone. Okay. Surround both and common on the prostate CA. Okay, so by zone, the prostate CA common in the peripheral zone. Okay, this is by zone. So arterial supply of the prostatic artery. This prostatic artery mainly derived from the internal iliac artery, a branch of the inferior vesical artery may also arise from the internal pudendal or middle rectal arteries. Okay, the venous drainage, prostatic venous plexus. Okay, ingat tadi prostatic plexus. Receive deep dorsal vein of penis and vesical venous plexus. Drains into internal iliac artery. Internal iliac vein, and some drain posteriorly through valvulus lumbar vein. Ini yang penting Some drains posteriorly through valvulus lumbar vein into vertebral venous plexus of plexus kat sini. Okay, lumbar vein. Okay, into this vertebral venous plexus. Okay, so anything kalau ada cancer ke infection, okay, it can cancer or infection in the prostate gland, it can spread towards the brain through this vertebral column and inside the thoracic cavity, okay, by this plexus. Okay, that's important of the prostatic venous plexus. Okay, lymphatic, internal iliac, sacral and obturator nodes. Okay, by internal iliac, okay, and sacral here, and also the obturator nodes here. Okay. So innervation of prostate in inferior and hypoglossal plexus, it has sympathetic, parasympathetic, and sensory. The smooth muscle of the prostate, okay, innervate by the sympathetic fibers, which activate during the ejaculation. Okay, so it's sympathetic. Okay, so this is how you perform the rectal examination or PR, rectal examination. Okay, so and when you put the fingers, okay, and facing anteriorly, you can feel actually the a bit of the bulging, not that much. It is a posterior lobe and a median sulcus of the prostate that you feel. Not anterior lobe, not lateral lobe, it's a posterior lobe. Right? Okay. Thank you very much for your concern.
Thank you, Doctor.
See you again tomorrow morning and afternoon.